you're well. I'm well myself. I welcome you back to my YouTube channel. My name is Jemienaftaly. I am a pediatrician by profession. This channel is called the Pediatric World. It is a world of children. Pediatric means basically means children. It's a world of children. So it is whereby I create the awareness on common illnesses affecting children while growing up. I do this in a language that every person, especially the mothers, can be able to understand. Also the guardians, every caretaker of these children. So it is a channel on kids welfare. So welcome. I know it has been a minute, I know. So welcome into today's episode. And the video of today, again, people have asked for it because I remember I had done it a long time ago. Now I'm going to summarize about it. It's about pneumonia in children. So a very common condition that we get every day in our daily basis in the hospital. There is no day that goes by without having a child admitted with pneumonia. So I did it a long time ago, as I'm saying. Now I'm going to summarize because several people have asked me to do it, and I'm going to do it in a simpler way, so that in a way that people are able to understand fast. So this is about pneumonia in children. So pneumonia is among the five killer diseases in children, the under 5s, those children below 5 years. Yes, it's a killer disease. It's one of the 5 killer diseases in children. So what is pneumonia, if I may go by definition? It's basically the inflammation of the lung tissues. So the lungs get inflamed. So now we get to have these now problems. Now pneumonia is classified into three. It is classified into three broad categories. We have severe pneumonia, we have got pneumonia, we have no pneumonia, and this now is cough and cold. Yes, so it is just three classifications, and we are going to see how we classify these three. It's usually through the clinical features, the clinical presentation. How these children present is how now we are going to classify this pneumonia. So how do children with pneumonia, the severe pneumonia, present? Normally, in all cases of pneumonias, children have to get cough or difficulties in breathing, or both cough and difficulties in breathing, or cough or difficulties in breathing, plus one of the following signs. So if they have cough and difficulties in breathing, or cough or difficulties in breathing, plus one, if they have got oxygen saturations of less than 90%. Remember, we said oxygen saturation, I've mentioned it before. This is we monitor how the body how the oxygen in the body is, and we say it should never be below 90%. So if the oxygen saturation is below 90%, this is one of the signs that you may point to say this is severe pneumonia. Yes. Another symptom, that one of the symptoms plus the two that we are saying, the cough and the difficulty in breathing, is central cyanosis. Remember, we said cyanosis is the blue discoloration of the body. Usually we have peripheral cyanosis, but here we are talking of central cyanosis. Example of central cyanosis whereby the child turns blue is on the tongue and also the mucous membrane. These are the mucous membrane. So here we are able to see that children have started to be blue in color. So, and also the tongue. This is now the central cyanosis because there is less oxygen saturation again. So central cyanosis is another danger sign. Another danger sign we have is inability to drink. So bigger children are not able to drink. They are not able to drink because they have these difficulties in breathing. They are having this cough, so they are not able to drink. They may be vomiting every time. Small children that are not now yet weaning, they are not able to breastfeed. Inability to breastfeed in very small children, this is a danger sign, and this one points at severe pneumonia. We have AVPU less than 8. Remember, we said the AVPU is a scale. We said it's a scale that is used to measure the level of consciousness in children. So AVPU below A, because remember we said A is for the alertness. So V is for response to voice. If you're able to tap the baby and they're able to respond. P is response to pain, and U is unconsciousness. So if a child is not alert, then the AVPU we say is less than A. So if the AVPU is at V, they're not able to respond to voice. If it's at P or it's at U, unconscious, so this is a child that may be having a severe pneumonia. It's one of the danger signs. We want this child to be AVPU at A, that this child is alert. So those are the 4 danger signs that we are saying that if a child has got cough or difficulties in breathing, or cough and difficulties in breathing, plus one of the 4 that we have mentioned, this one points at severe pneumonia. I hope you understand. So now that is how children with severe pneumonia present. Now let's go to the second classification. We said it's pneumonia, just pneumonia, it's not severe. So how do these children present? Again, they have got to have the cough or difficulties in breathing, or both. Now both cough and difficulties in breathing, plus now lower chest wall indrawing. This one we are remember I tried explaining what lower chest wall indrawing. It is whereby the child is training to breathe. So when you expose, we normally expose the chest, and you are able to see the ribs. You can easily count the ribs. Because that child is using those intercostal muscles to breathe, so they get inside and you're able to count. So this is what we call lower chest wall indrawing. If this child has cough and difficulties in breathing, and then they have lower chest wall indrawing, also they have got fast breathing, again is a sign of pneumonia. Fast breathing. And what do we mean by fast breathing? Fast breathing, we mean if a child is between 2 months to 1 year, and their respiratory rate is what we count when the child is breathing. If their respiratory rate is more than or equal to 50 breaths per minute, that is a child 2 months to 1 year. So these children, if their respiratory rate is above 50 breaths per minute, or it's equal to 50 or above 50 breaths per minute, this is what we call fast breathing in those children. If the child is a bigger child, if the child is 1 year to 5 years and their respiratory rate is equal to 40 or more than 40 breaths per minute, that is again high. It is increased respiratory rate to that bracket of children. Now again, this we call fast breathing. So what are we saying? The signs of pneumonia, just pneumonia that is not severe. This child has got fast breathing, and we have said what we mean by fast breathing depending with the age, and also if they have lower chest wall indrawing. And on top we have the cough and the difficulties in breathing, or cough or difficulties in breathing. Hope you get. Now that is pneumonia. So if you note, you can be able to note we don't have the danger signs we say for the severe pneumonia. So that is just pneumonia. How about our very last and the 3rd classification, which is no pneumonia? So this child cannot be classified to have severe pneumonia. This child cannot be classified to have pneumonia. There is no pneumonia. Just call it no pneumonia, or cough and cold. So these children normally will present with just cough. They are going to have maybe nasal congestion. They are going to have nasal discharges, yeah. So they have got no pneumonia, they just have cough and cold. They have just the flu. So this is what we call no pneumonia. So this now points to my 3 classification of pneumonia: the severe pneumonia, the pneumonia, and also no pneumonia. So how do we go about treating these 3 classifications of pneumonia? So severe pneumonia, you need to admit this child, because this child is very, very sick. With the signs that we say, the danger signs, the first thing you need to do, you need to admit this child. This child is a child that will need oxygen. Remember, we said that I did a video, you can go back to a video I did on oxygen prescription, or how we deliver oxygen with different types. So this child will need oxygen, because remember we are saying they're very, very sick. They have even central cyanosis, which you said is the blue discoloration due to less oxygen saturation. So this is a child that you're going to start on antibiotics, and it's just not the oral antibiotics. You want to admit for something we call IV antibiotics. IV is the intravenous. You want to put a line here through the vein. It's where you'll be putting your 2 antibiotics, and we normally combine 2, which is called benzyl penicillin, or in another name we call it Expen, plus another drug we call gentamicin. So we're going to do both intravenously. So The two drugs is what we are going to treat severe pneumonia with. It's the first line. They are the first line drugs for severe pneumonia. So we admit, we have given oxygen, we have given IV antibiotics again. Also, you need to monitor the SpO2, the oxygen saturation. Remember, we said for the children with severe pneumonia, they present with SpO2 or oxygen saturation of less than 90, and we don't want to be below 90. This is a danger sign. So we want to keep monitoring. We have the monitor. We keep monitoring in hospitals, in the ward. Also, these children, you need to do supportive care. Yeah, supportive care is you need to monitor other vital signs other than the SpO2. You need to monitor the temperatures. They might start having temperatures. You need to support. If they have temperatures, you may need to give IV paracetamol. Yes, you may need to give this child, because they are not feeding, IV fluids. We need to do the intravenous fluids to help this child get better, because they are not able to feed. So those are some of the supportive care we mean on top of what we have just said. So this is for severe pneumonia, very, very important. Now let's treat just pneumonia that is not severe. For the pneumonia that is not severe, we do not need any admission. Get me correct here, because here is where majority of the people misuse drugs or they mismanage pneumonia. It's not new severe pneumonia. So what you do, you give oral antibiotics, and you just need amoxicillin. The usual amoxicillin, you don't have to go to those strong ones. Imagine amoxicillin high dose, and when I say high dose, it's usually 40 to 45 milligrams per kg per day per dose, 12 hourly. So what we are saying, what we mean by per kg per day, you need to calculate using the kilos of these children. In all cases, remember, we said when you're treating children, you want to do the dosages per kg. You need to do per kg. So 40 to 45 milligrams per kg per dose, and these you're going to give twice in a day. That is 12 hourly, twice in a day. Yeah, so just high dose of amoxicillin. I did not mention those strong drugs that people just rush into getting them, and yet the child is not so, it's just pneumonia. So high dose of amoxicillin will do best. Now what you need to do, you need to counsel the mothers on the danger signs for the severe pneumonia. So you have to tell them when they go home and they realize, now teach them about the danger sign. If they find that this child has started getting blue, other things, if they have started becoming so sick, they are not even alert, they have started getting unconscious, they're not able to drink or even breastfeed. So those are the danger signs. Counsel the mom about those, because it may develop from being pneumonia to severe pneumonia. So if they see this, they should not stay at home. They should come back to hospital now to treat for severe pneumonia, because remember we said for severe pneumonia you cannot do it at home. We have to admit the children for the treatment. So now that is the pneumonia treatment. Then all children must be reviewed within 48 hours. You have to review these children and reclassifying pneumonia. The child may move from pneumonia to severe pneumonia. The severe pneumonia, after 48 hours of treatment, you review and you're able to classify to pneumonia. They have improved from severe pneumonia to just pneumonia. So you have to review after every 48 hours. Now, our last one, which is non-pneumonia. How do we treat the non-pneumonia? Remember, we say this is cough and cold. This, we do not have any danger signs. We do not have fast breathing. We do not have lower chest volume drawing. So we just treat like just for cold. So what you do, you give things to soothe the throat, yeah, like honey. You need to rehydrate this child. You need to give them a lot of fluids, oral fluids, and these are warm fluids, not cold. So this is how we do. This is the home-based care. It is the home-based care with the home things. The honey, you soothe the throat. You give some fruits. Give oral, you're saying oral rehydration by giving a lot of water. You may not need antibiotic in non-pneumonia, just cough and cold. I know mothers get worried. They just rush to a nearby pharmacy and they just buy an antibiotic. Yes, it is a child with non-pneumonia, just cold. It's not important. Please hear this and get to know what I'm saying. It is not very important to use antibiotics when it comes to non-pneumonia. So this is how you treat all of them. Imagine it's just home-based care, the things that we are saying. For the saline, for the discharges you may give to do maybe antihistamines. So you can understand there's nowhere that we are mentioning antibiotics. So again, we keep monitoring like you're saying, so that the child may not proceed from now no pneumonia to just cough and cold, now proceed to pneumonia. So now that is when you are able to give the antibiotics. Hope this is clear. This is a video that majority have asked for, and I said I had done it before a long time ago, but I decided to just simplify it and just come here and talk about pneumonia. So that is it. Now you know the 3 classifications of pneumonia, how to treat them. Yeah. So thank you so much for always keeping tuned. Thank you to those who have subscribed. We are road to 5K subscribers. Yes, and I know this is possible by you guys. I know we are going to do it. If you haven't subscribed, hit the red button, subscribe to be part of us, be the part of this family, because this is a family. We want to be a bigger family. We grow by, with time. So if you haven't subscribed, kindly subscribe. Others are watching the videos but they are not subscribing, the biggest percentage. Please subscribe to be part of us. Stop watching and you haven't subscribed. Turn on your notifications to know every time I'm posting a new video. You'll be among the first to watch, so please turn on all those notifications. So thank you so much. Until next time, bye bye.